Hi, and welcome to Unveiling Sickle Cell Beyond the Pain. My name is Tabitha McGee. I'm your host and the Executive Director of the Sickle Cell Foundation of Georgia. Fun fact, in the U.S. Army, I jumped out of planes as one of the few women paratroopers in the U.S. military. That training keeps me flying high in life. Today, we're promoting health and wellness. It all happens here, and it all starts right now.
I know the questions in your mind. Unveiling sickle cell beyond the pain. Now I believe that I can get through anything. Past the touch, now you can unveil sickle cell beyond the pain.
Welcome to Unveiling Sickle Cell Beyond the Pain. On this talk show, we're excited about advocating for the sickle cell community. Taking good care of your health is key to living well with sickle cell disease. Today, we're excited to have two very knowledgeable and powerful warriors with us. They set an example by making their health a priority, and they both work here at the foundation. Dana Hill is a mental health nurse practitioner with 18 years of diverse nursing experience and has a passion for holistic care. Kieselon Wright is our newly promoted program coordinator. She's an educator, a mentor, and an advocate for sickle cell, and she has always believed in holistic health care. Welcome to both of you. I am so excited that you're here today. I know we have a lot to talk about, so we're gonna go ahead and jump right in if you guys don't mind. So I wanna talk about your roles in promoting health and wellness because I know how very important that is to both of you. So Kieselon, let's start with you. Talk about your role promoting health and wellness.
My role promoting health and wellness is as a program coordinator here at the Sickle Cell Foundation of Georgia. I help the transition age clients, ages 16 to 25, making sure that they have lived the best life living well with sickle cell disease. So how I promote preventative care with them, I ask certain questions just to make sure that they understand a little bit about knowing their body, knowing their gene type. And one thing that I make sure that they are in preventive care or learning about preventive care, I do an assessment.
Okay.
And that's how to determine if they need more preventive care.
So tell me a little bit about this assessment. You say you take an assessment. So what does that look like? Tell me about that. What does that entail?
So I do a transition assessment. It's like a two-part series. So I first do the GOT transition assessment, and it talks about, are they scheduling their appointments? Do they know different things about their medical history on their mother's side, their father's side? Do they know about their insurance? Are they drinking water? And then I do an assessment that I develop, and that assessment deals with their whole body. I make sure that they understand that they are good spiritually, mentally, physically, and make sure they're good socially, because we all know that living with sickle cell disease, you have to be in a good place socially.
Oh, wow. That is so incredible. So you say you actually invented that document. Oh,
Yes, I did.
That's so powerful, Kieselon. Wow. So Dana, as a nurse practitioner, you've been in this industry for a long time. You know a lot. So tell us, what do you do to go about promoting health and wellness to the warriors that you face on a day-to-day basis, all day, every day?
So I currently work in the Sickle Cell Sanctuary. I'm dual certified as a psychiatric mental health nurse practitioner and a family nurse practitioner. So that encompasses head to toe,
Okay.
the mind and the body. So we provide mental health services. For the warriors, we do IV hydration, we do nutrition counseling, and hematology care. So a little bit of everything.
Okay. Do you find that the sickle cell warriors are open to holistic, integrative care, or do you feel that they like more of a traditional route of care?
I think both.
It is. It's definitely both, and I think it's becoming more prevalent to do both because a lot of them are asking questions about how to implement the traditional medicine and holistic services in their life.
Some of them have already started, and they come in with questions about the things that they're already taking and how they can continue to take it with the traditional medicines and the interaction. So we do education on that as well.
Oh, I like that because, we've always said that integrative, holistic services is a complementary to Western medicine. You need them both. You can use them both. There's nothing wrong with that. And so I'm really glad that our sickle cell warriors are starting to really understand preventive care, keep them from being reactive in the back end, right?
Absolutely.
And then it also has helped decrease the number of emergency visits, the number of hospital stays. And that's what we're really looking to do is really make an impact there. So tell me about you, because I know I heard through the grapevine that you are very health conscious. Like you love holistic care. You try not to make medication if you can, and you really haven't been hospitalized that often. So tell us about you.
Oh, yes. So I've been doing holistic care for about 3 or 4 years.
Okay.
It's something that I wanted to do for myself because of the things that I experienced when I was younger with my family members that had sickle cell disease, and I wanted a better life for me,
Okay.
healthier life for me. So I started doing massage therapy about in my 20s.
Okay.
And the reason why I started massage therapy is because I was having a lot of leg pains. So I started seeing a regular massage therapist on a regular. I pick and choose when I go to see her, and she started working on different areas of my body. She would actually ask me, like, what areas you have more pain? What is your target area? So majority of the time, I tell her to work on my legs. And I noticed that, going consistently and taking good care of my health, the pain crisis started lessening in my legs.
Okay.
So when she would work on my legs, my blood cells will flow much better. So when it's like time for me to walk and stuff, I don't have as much pain. And then when it's mostly during the month, when the females are having their monthly cycles,
Okay.
I notice that my blood flows much better. The blood cells are not sickle. I don't have to get up at night worrying about my legs clumping up on me because I'm taking the proactive needs to do the regular care for massage therapy. I also do chiropractic work. I've been doing that for about 2 years to readjust the alignments in my back, also my lower back, because I have a lot of lower back pain due to the sickle cell when the season changes. So when I get my adjustments in my lower back and my shoulders and my neck, it helps me sleep better at night. And acupuncture, just started that also about 2 years.
Okay.
And I'm really enjoying the acupuncture. It's like my best holistic care ever, besides the massage therapy. So with my acupuncture, she does a really health assessment.
Okay.
I mean, a really total health assessment on your maternal side and your paternal side. And she also do a health assessment on me, and taking all those 3 health assessment and asking exactly what you need. She feels your body just to see what areas you need to be targeted. So she used a method where she used the medicine incense, and she used the needles. I love the needles. I can't really feel it a lot until she gets to my feet. So the areas that I noticed a change is when she does the needles right here and massage my head, I noticed that I sleep much better. I noticed that my balance is better. It's not like off when I'm walking, and I just feel better. My energy is on another high. I'm just naturally high energetic, but it's just
Well, that is
really good for me.
super fantastic. So we have someone that's not just educating and teaching, but you're also doing it yourself. And so that's
Yes.
great. And so Dana, give it to us from your perspective, how are you taking advantage of the holistic services, integrative medicines, coupled with, I know you talk about Western medicines, for your own holistic care as well?
The one that I've probably been doing the longest is IV hydration.
Okay.
I take advantage of everything that Key Salon does, which is the chiropractic care and massage therapy, and do those monthly. But IV hydration is something I've been doing for the last 8 years now. And with that, we can add vitamins in there that helps with the symptoms that sickle cell patients have, like fatigue. You can load it up with vitamin B. We can add some L-glutamine, which help with the production of red blood cells. And vitamin C, we know most sickle cell patients are immunocompromised. So that helps them to fight off infections. And the hydration, even by itself, helped to get the red blood cells moving so they're not clumped up, as she's saying. So
Oh, wow.
I think IV hydration is my favorite part of holistic care.
And I love IV hydration myself, so I'm really super excited about that. I have a lot more questions of both of you all, so we're gonna go to commercial break, and we want you to stay with us, and we'll be right back. We're so glad you're back with us. So ladies, let's just jump right back in, because that was so phenomenal what you guys did. I mean, you gave us a lot of great information. And so we've already talked about the importance of, integrative medicine along with the Western medicine. We want them to continue to do both. We talked about being proactive rather than reactive, right? And so now I want to talk about a very, very key ingredient because, you know, Keislan and I really pay attention to this, and I know you do as well, nutrition. Keislan, I want you to really talk about this because I don't really think most people understand the importance of nutrition and how that is like 80% of our entire makeup, right? So can you tell us about that, particularly when it relates to warriors, making sure they're eating well, you know, now it's fried food. So I want to talk to you about nutrition. So let's talk about nutrition, and then I want you to tell me, is there any particular foods you recommend and why?
Okay, yes. Nutrition is very important living with sickle cell disease because we need our vitamins, we need our minerals. A lot of times, if you're not eating the proper stuff, we may not get the things that you need in your body. The nutrition that I think that is recommended for people with sickle cell disease is definitely green, leafy green things that are green in color, which most people don't like to eat. Grown-ups, kids don't like to eat things that's green because they think it's nasty or it's ugly. But anything green, colorful, make sure you eat that. So spinach is a good thing that people with sickle cell disease need to eat.
Okay.
Collard greens, mustard greens
collards.
is really good, and kale is also really good.
Okay.
So making sure that you implement your greens throughout the day will help with just your energy levels. Also, the green leafy vegetables will give you your folate that you need as well. So some people may not take folic acid as a pill. You can get it in your leafy green vegetables. So that's another way of getting what you need into your body. Another good thing that people with sickle cell